Don't call me seronegative. This is a QD clinic brought to you by Room Now Live. I'm Dr. Jack Cush from Room Now, and our case today is called Don't Call Me Seronegative. A 42-year-old guy comes to see me, transferring his care from another city where he was diagnosed by a major university with a big name, like this university a lot. Don't know the doc there, but if they're good enough to work there, they're good enough to work anywhere. Wait, that's New York, New York. Anyway, and they diagnosed this gentleman with acute onset of polyarthritis and hands, knees, feet, whatever, as seronegative arthritis. And then he gets treated strangely with one round of nonsteroidals, and then he gets a TNF inhibitor that doesn't work, and then he gets another TNF inhibitor that does work. Never methotrexate, never prednisone. And he's had a little bit of back pain, but really not really. And so the next 4 years ensue. He's taken care of by 3 rheumatologists, and he's called seronegative arthritis, seronegative RA, and seronegative spondyloarthritis. What? These are actually 3 divergently different conditions that aren't even close to each other, but the term gets thrown around not like manhole covers, but like nickels. I like that analogy. And I don't think we should be using the term at all. So let's be clear. There is no such thing ever again in this world as seronegative spondyloarthritis. It's just spondyloarthritis, or axial spondyloarthritis, or non-radiographic axial spondyloarthritis, or ankylosing spondylitis. But never is it seronegative. It's supposed to be knucklehead, talking to me, if I've ever used that term, and you, if you've ever used that term. Spondyloarthritis, spondyloarthritis. There should never be another chapter written. And when you do a search looking for, as I did, I was writing chapters and pieces and lectures on seronegative RA, I could only find things written about seronegative arthritis, seronegative spondyloarthritis, and it's all talking about SPA-related disease, not about RA and inflammatory arthritis, peripheral arthritis related disease. So there is no more seronegative spondyloarthritis. Do not use that term. You can use seronegative RA because you diagnose rheumatoid, the tests come back positive, boom. It's one of the 20%, 15% who are, in fact, seronegative for rheumatoid factor and CCP. We don't care about B27. That's talking about that other condition we just spoke about, spondyloarthritis. And then, seronegative arthritis is like the most non-committal label, and shame on any of us who use that. Call it what it is. Inflammatory arthritis, I don't know arthritis, wish it were arthritis, I hope it ain't arthritis, whatever, but don't call it something that doesn't say anything like seronegative arthritis. I'm not even sure it really is arthritis when you call it that. But it is important, I think, to maybe use the term seronegative RA. It's 15 to 20% of patients. It actually denotes a condition that's severe, more severe than seropositive at the outset, because you got to have more criteria to be called RA, because you can't have the seropositivity. And over time, they may respond as well. They may have less X-ray progression, and they may respond less well to at least rituximab and abatacept. Seronegative RA is an important subset. It's just not a subset of RA. It's probably another disease. But again, the big point of this whole schlemiel is let's drop the seronegative spondyloarthritis term. It's so archaic, so confusing. 3 really good rheumatologists in the last 4 years have used it inappropriately in this patient, who, by the way, doesn't have any of those conditions. Seems like it's a lot of arthralgia related to bad sleep, if you know what I mean. Anyway, that's it. Check out our roomnow.live site for more information on registration. Tune in tomorrow for another QD clinic.